Often in general practice, we're asked to create bids for healthcare pots of money, for resources and various other aspects in really crazy short time frames. So what would be useful is to have, a process or a bid ready off the shelf to go. And in this episode, we're going to show you some of the processes myself and Andy have looked at in terms of creating this for the work that we do in general practice and PCNs. And hopefully this will help you manage these challenges every single time they come to you, regardless of what role you've got in general practice. Let's take enhance your primary care and learning. Hello, EGP learners, and welcome to this episode where we're looking at creating bids for the NHS. It may seem like a bit of a dry topic, but it's going to be something that I think that may be really powerful and useful for many people to come across, particularly if you're involved in funding of healthcare. What do you think there, Andy?
Yeah, so I think this is something that's probably going to be really useful for people, actually, because we are also often, as GPs in primary care, in the position of saying, why are the services that people commission for us, the interventions and projects that people put in place to try and help support primary care, why do they sometimes hit the mark? Why are they sometimes not quite what we want, quite what we would ask for, quite what our patients need? You might think we might have better ideas. Why do our ideas not get noticed? Why do our ideas not come to fruition? And to us, there's something about being able to take what our ideas and articulate them simply without spending too much time in the language of the commissioners and the other stakeholders who greenlight projects, who pick up good ideas and run with them. But there's something about translating the good ideas that loads of people in the EGP learning space out there watching might have, and translating them into something that can get noticed and get picked up and probably deliver real value for people. So hopefully this episode will help with that.
Absolutely. And I think for us, it comes from a common challenge that we've often faced and quite recently had a real bunker of a version of it, wasn't it? In terms of we were asked to put a bid in for potential resources for our local areas, and we had something like a 48-hour time frame to do so. And that's really challenging to do. And that's partly because they needed us to finish our part, so then that can feed into another group, that can feed into another group, that then actually goes to the actual deadline for the time that is often very short, particularly within NHS. So having off the bat kind of proposals that you can just pick up, slightly adapt, tighten up and neaten it, and then submit can make your life a lot less stressful, but also hopefully mean you're more likely to be successful in achieving those objectives for your patients and for the organizations that you work with and stuff. So that's what we're going to be looking at in this episode and stuff. Where should we start then, Andy?
Well, let's start just as you were saying, Andy. Sometimes you don't. If you're asked to come up with something on the spot, it's difficult to come up with something, isn't it? So I think the first step is to just be aware that these pots of money, these requests for bids, they happen all the time. And you can anticipate them coming. And sometimes you can look at what the kind of trends or the priorities are, and you can think you can anticipate what they're going to be about, what they're going to be for. So having some ideas, in your desk drawer, under your bed, under the mattress, in the collective consciousness of yourself and in your organization, or perhaps group of organizations that you're working with, of things that you would like to do if there was some funding available, and just keeping those ideas alive give you a starting point. You might even flesh them out and do some provisional planning around them. Sometimes it might be things that you're going to do or you want to do anyway, and you think, actually, can we adapt this to make it suitable for this bid so that we can actually get some additional money and do this better, do it quicker. But just having ideas is really, really important as a starting point. So that's where I would start, really, to get into that mindset of just always having some ideas on the go about how you can help your population or your organization. But I suppose the next step is, there's an announcement. We need you to bid for funding, or we found a pot of money. So what are the next steps, would you say, Gandhi, once that announcement is made?
Well, I think the first thing is always answer the question, isn't it? So often these bids come with an element of description of as to what it's about. So there'll be particular criteria that funds can be used for. It may be around, for example, access. It may be around health improvement. It may be around different parts of the healthcare system. So making sure that it's aligned to the actual ask. And then I think there's also the question of who's making the ask as well. It comes a huge part of it. Is that the local ICB? Is it a national ask? Is it a different cohort organization that, for example, has it come from third party funding that actually aligns to their principles and stuff? So, what is the ask and who's making the ask are two really important questions that you need to consider, particularly if you're trying to align a plan that you've already got, because you may have to make a little bit more adaptation and stuff to it, or you may have to actually start again. But hopefully using our template, that will help to structure that whole process for you and stuff and things. But that's where I would start. And obviously the other one is, how much money are you actually bidding for? Because that massively changes what you're trying to put in as well, doesn't it?
Yeah, I say, and what's on the table really in terms of funding, the scale of the funding,
Mm-hmm.
you know, and also, is this funding recurrent as well?
Yes.
That's really, really key because that really changes the type of project that you will be putting in place and, how
Mm-hmm.
feasible these things are. A lot of pots of money are for one-off projects that you have to run within a year and then they will stop or you have to bid for further non-recurrent or recurrent funding afterwards. Sometimes you might be bidding for some recurrent funding. This is a service that might be anticipated to be in place for several years, and that will change how you structure
Mm-hmm.
sorts of things that you might put in your bid. So I think that that's really, really important. I'd always recommend getting a really good handle on who it is who is providing the money and who it is who's making the funding decisions as well, because that'll
Mm-hmm.
factor into some of the thought processes around what to include in your bid later on, because you need to speak to their objectives and what they need to or
Yeah.
to achieve as well. I think that's really important just to understand who the stakeholders are in
Mm-hmm.
the bidding, process. The other thing as well I would say is partnerships are really important as well, so that can really help strengthen your bid. So actually, as you're getting your ideas ready or keeping them cultivated,
Yeah.
it's really great if you are talking to partner organizations. You have organizations you can quickly partner with. You might have ideas of things you can do together with other organizations, because a joint bid, is really, really good.
Mm-hmm.
Be popular, looks good. It's in the spirit of collaboration. And other
Mm-hmm.
organizations bring resources, to help
Absolutely.
support the process of doing the bid.
And you're
So
right, they're
just
more
further
likely
thought.
to be successful, aren't they? So, you can imagine that, for small pots of funding, you may have a practice making a bid, but actually if you have a group of practices, whether it's a couple or a network level, in terms of practices making that bid, it's more likely to be successful because there's an element of reliability that comes with that. Alternately, if it's a potentially larger pot of funding that you're looking at, working within other networks, working with other partners in the place-based area, like federations or even hospital or community-based colleagues and stuff, because you've got that reliability of other people being with that part of funding and the bid and stuff. It just gives a little bit more reassurance to those who are allocating the funds that actually this is more likely to be used effectively, rather than the concern that often they have that it's just going to someone's back pocket, which isn't the case often. But that's one of those niggling little things that people have, isn't it?
Yeah, or there'll be waste of money and it won't be
Yeah.
used, effectively to meet the objectives of the bid. Charities are another good category of organisations to partner with as
Mm-hmm.
well. I'm just thinking about local framework, local housing charities, things like that. They're often quite experienced in writing bids as well, because
Yeah.
charities are often bidding for money, so they've got a lot of relevant skills as well.
Mm-hmm.
So just some general points, I think, in terms of structuring a bid, or what in my mind it's
Mm-hmm.
important to try and do when you are writing your bid. And I think it's about connecting a few things together. So you want to be addressing a need. There needs to be a reason to do it
Yeah.
in the first place. So I think you need to establish that need, and that will probably be through data,
Mm-hmm.
perhaps through patient experiences or case studies, um, and the suffering that's there already. People talk about this sort of pathos and logos, don't they? Appeal to logic, appeal to people's hearts. So
Mm-hmm.
I think that's a useful starting point. It's helpful to understand who's awarding the money.
Mm-hmm.
There's something about strategic relevance and strategic fit, I think, in a bid. So for example, a bid that encompasses some element of addressing inequality, for
Mm-hmm.
example, that perhaps has a population health management component. These are things that are perhaps an access, component as well. We know that these are strategically important things for the NHS. You can always look at your local ICB or other organizations strategic plans, to see what their stated strategic objectives are. And if your bid speaks to those, you can have a much better chance of success. So I think that that's really, really,
Yeah.
good advice, to be honest. Um, but yeah, any other thoughts, Gandhi, about things that you're trying to just kind of connect and bring into your bid?
I think, like you said, it's speaking towards the objectives of the organisation and understanding what those potential objectives are. So, a lot of the funding opportunities I think our EGP learners may come across are things from, for example, networks or ICBs or that kind of stuff. And a lot of that will focus, for example, on access, as you mentioned, impact on secondary care. We know that secondary care expenditure is massive. So actually anything that can reduce the amount of acute spend will always be considered as a more favourable topic compared to something that may have real groundbreaking opportunities but isn't as noticeable and stuff. And that's sometimes where, therefore, the way you try and form that bid becomes more challenging because you're not having as much of an impact on a real pressure point within the system. So I'm aware that pretty much any bid that comes through that has potential to really reduce the backlog, likelihood that will be favored over something else because the backlog is the big pressure point for many places right now, isn't it? So, it's understanding those pressure points and how can your potential bids help with those. Doesn't mean to say has to, but you've got more chance of being successful if it does.
Yeah, it's about understanding, the language that organization speaks and, what their priorities are, even if they're not out there in the strategic document. Often it's about productivity, it's about efficiency, it's about quality improvement, as well. So that's another angle
Yeah.
to speak to, and that's important. Um, and yeah, a lot of it comes down to cost reduction and efficiencies, doesn't it? So being able to speak to those and demonstrate an impact on those is really, really helpful, I think. Another thing that I think is useful is they talk about, in terms of persuading people, pathos, the heart, logos, the brain, and ethos, which is about embodying or being the sort of organization or person that can deliver. So there's something about just demonstrating, in terms of the quality of the bid or in terms of speaking to existing capabilities or enhancing or building on existing capabilities or experience that your organization can deliver, as well. And so allowing that to come through in some way in the bid, I think can be really helpful. So it's good. And then Gandhi, I guess you come down to the nuts and bolts of actually what are you going to say you're going to do and how you're going to do it, within the bid as well. So I think we're looking at kind of delivery management, costings and maybe risk management as well. So, how would you kind of join those together or include those, Gandhi?
Well, it's the question of how you, as you mentioned, how you're going to deliver it. So what do you need in order to deliver on the bid itself? What staffing you're going to need, what estates you're going to need, premises, equipment, resources. Project management is a big one. I think many people within general practice forget that you need to cushion in some project management time because it's a change and you need to have that perspective and that headspace time to tackle it and how you're going to fund that. And actually that's often how other kind of companies bid and some of them will aim to make profit. I think most general practices won't. They'll aim to make improvements with a view to having more time available, not to forget the time that it can save and how you can then maximize the use of that time to help benefit the system as well, and things. And then the last one, I guess, is obviously risk management. What's the risk of doing this, but also what is the risk of not doing this is just as much as a powerful message to share and things.
Yeah, absolutely. And I think it always impresses people if there's been some consideration of risk, because I think that's something people don't always talk about. And it's about risk and it's about mitigation, isn't it? So there's a risk to delivery that the practice won't engage. The mitigation is that we've included a payment to backfill, some engagement from practices, something like that. We've seen the risk and we've mitigated it. We are the sort of organization that is capable of doing risk management. Yeah, and just back to that delivery point, I often think about it in terms of, you're going to need people, you're going to need places, you're going to need equipment, and you're going to need coordination, and then you can just begin to break those down depending on the project. People need paying, people need training, people need managing. Equipment is physical, equipment is software tools. There's all sorts of ways to break that down. And then I guess there's the format of what you're delivering. So I mean, I've submitted not bids, but just kind of ideas for things that can be done that have actually ended up being done, like some signposting work that happened a few years ago, some signposting training. And, often you just begin with a plan on a page, that speaks to those points that we've said before, addresses each of those somewhere in a structured way that's easily digestible, and try and just get that under people's noses to get it funded.
Mhm.
Alternatively, sometimes you're given a format that you need to apply to your bid. So I think, Gandhi, we're going to put you on the spot, aren't we? Next.
Yeah, so we're going to give this a go. So we've created a kind of spreadsheet document to try and support people in terms of the process of this. This is following on from recent bids that we've had to do and our own perspective of things you may need to consider. So let's pop it on the screen, shall we, and to show you what we've come up with and stuff. So this is our EGP Learning Healthcare bid template. And as you can see, we've got a variety of different things there. So we've got the name of the bid, the awarding body, which is useful information to know and stuff. Amount requested and non-recurrent, recurrent, and as you can see, they've got zeros in them at the moment because we're going to fill those in for you as we go across. Total amount requested, which then is a tabulation from there. Date created, because that can be relevant if this is something you're keeping, as we mentioned, on the shelf, and the date it was last reviewed as well. Name of the bid creator, because that's always useful to know who created it, potentially if this is something you've kept at the back. And then, Andy, you mentioned about that whole, how can you get this across? So there's two parts to think about. You've got the elevator pitch. It's that quick, short, snappy. How can you manage that? And for this template, it says 600 characters. That's partly because Google Sheets doesn't allow you to limit it to words, it's characters. And then 6,000, which is approximately 1,000 words as well. I don't think we're going to fill that one in today because that's going to take a bit longer, to be honest. But and then this is the key things I think to look at. So what local, regional, or national strategic elements does the bid fit in with? And that's what we talked about, trying to help you structure. How is this bid feeding into other pieces of work? How is it feeding into, if you're talking about national stuff, how is it feeding into the NHS priorities? How is it feeding into Core 20+5? How is it feeding into the Fuller report or the Health Select Committee general practice report? What documents is it looking at? Both, you can look at that nationally if this is a more local bid. What about your local ICB's objectives and stuff, or the local hospitals' objectives in terms of their secondary care provider? How does it feed into those documents? And having the data there for you to reference to just makes that whole hopefully easier and stuff. This is a really important one, I think, that many people forget on. Who will deliver and lead on the actual project? You need somebody that is going to take this forward, and you can't just assume it's going to be somebody else. You have to, in my view, you have to have a name on paper.
And that really improves the confidence of the people reading the bid as well. That somebody has put their name to it, that there's going to be a single 1 or 2 points of contact, for discussing the bid. That's really, really important. I was just going to say that the beauty of working with what is probably a team of people to pull together a bid on a document like this is that everybody has, from an early stage, the same shared understanding of what's being achieved. And, when they're going out to bat for the bid, they'll be using a similar elevator pitch, a similar description, because in the early stages, sometimes people can be a little bit at cross purposes really about what they're trying to achieve. So I think it's really good to go for a document like this at an early stage to flesh things out. But do carry on talking through the document, Gandhi.
Yeah, so then we've got, how does this bid improve the outcomes of the population itself? And that's obviously one of the key things a lot of people will be looking at. So, is it around the clinical effectiveness? Is it around the actual population health and stuff? So what impact is it going to have on the local population? And that's something that you do need to, I think, with any bid, demonstrate and stuff and explain a little bit more detail. And this is your opportunity to use detail. So we've picked a few topic areas that we've come across that are there. How does it tackle health, inequalities, health inequalities, other type of inequalities in terms of, experience, and particularly, as I mentioned, access is a big one that's always going to be considered. How does the bid enhance productivity and value for money in particular? So actually, is this something that will help improve the effectiveness, for example, of a team? That can then actually mean that there's more availability of that resource. So, a really good example would be paying for online consultation platforms. How can they actually be maximized by having potentially additional or different tools, or continuing even with the same tool? Actually, how can you justify the existence of that to mean that actually this needs continued funding? And actually, I know a lot of places are going through a similar process in terms of what they're looking at moving forward. This is an opportunity to share that kind of information and stuff.
I would also add, you can start to put some figures in here. So if you think you're going to be saving time, you can calculate hours saved and put a monetary value on that based on, the hourly remuneration for certain staff categories. It might be that you think that you will be able to prevent amputations or some other, costly consequence further down the line. I think it's okay to play with some of those figures as well. What I would say about
Mhm.
figures as well is often at the stage when people like we are doing these things who aren't really trained in bid writing, um, uh, it's just about getting other people on board with the bid or getting over that first hurdle. If this is going to
Mhm.
be delivered as a large project, other people from within other organizations will support,
Yeah.
people who understand um, cost analysis and cost benefit analysis and, business processes and so forth. So often it's about just getting over those first few hurdles. So I would
Mhm.
say don't be too afraid of attempting to make some of these calculations, and people will come in and support you and tidy them up later. Carry on.
Mhm. Absolutely. So, how does the bid affect in terms of NHS wider implications? So, in terms of social aspects, economic changes and development, is it something that is going to have a community effect actually, and that will then have a positive effect on the local health population and things? So, if you want a quick idea, how can a park run project run by the local PCN have a benefit on the local population? Well, actually, that's not something that potentially physical health you'll be able to monitor and impact, but actually we know that that's a community group project that could have other impacts and stuff like that. What aspects of risk management are relevant with the delivery? And we mentioned as well about not delivering this project, what are the risks of by not doing this piece of work, and that it's worth always trying to articulate that, I think. And then just other bits in terms of anticipated time frame that you would need to establish this, and then are there any actual potential hurdles or opportunity that are coming that may both hinder or enhance this particular bid? And I guess there's always potential issues in terms of political stuff that may have an impact locally or nationally, but actually is there certain other things that have to happen? Like example, if you're looking at a bid for a software piece, do patients need access to their records? So actually, is that the hurdle that needs to be overcome in order to make this a more viable thing and stuff? So it's just trying to formulate that kind of stuff in terms of the concepts, and then that takes it further in terms of looking at cost. So the second part, just that you can see here, and we've just put it next to just to make it a bit easier and stuff to share and things. So looking at the costs, and we talked about these. So biggest cost with most bids tends to be about staffing, what are the staff, and always remember you need to add the on costs. A lot of people forget that when they make these kind of bids. They think about the the cost of the salary, but they forget that there's always on costs in terms of tax, in terms of pension and that kind of stuff that need to be factored in. Otherwise you're going to underestimate and struggle. You've got estates and premises. You need somewhere to run a service from, even if it's a virtual service. Well, you still need somewhere potentially, or some other kind of equipment. Or if it's a community project, you may need to hire a room to deliver this through for patients and that kind of stuff. Or even just somewhere to receive stuff from, for example. If it's a community bowel project, a screening project thing, that how are you going to collect those samples? How are you going to time that? What are the kind of things that come into play? What equipment do you need? We talk about tech equipment, computers, but is it more specialist kind of stuff, devices, that kind of thing, and software as well? Incorporating the obviously estates, you also need to think about things like electricity, utilities, all those kind of things, that they come into this as well. Project management, we alluded to, a lot of people forget that this requires headspace time. It requires someone to coordinate and organize it, and actually that does need to be funded. Or is it, as you mentioned, Andy, engagement with other partners? Actually, do you need to incorporate the fact that you need to have some of that to make it more likely to be successful? And as ever, there's always useful having an other box just for those unanticipated things. And we split this, as we mentioned earlier, into both non-recurrent and recurrent potential funding pots that you may need to consider. And this will total it all up. And I mentioned earlier that this will then put it into the different categories for you. So it's a spreadsheet. So I'll put the totals into the front part of the bid for you once you've done it and stuff and gone through that process.
Absolutely. And the costs provide a bit more clarity around the delivery plan. And I guess the delivery plan, maybe not explicitly stated, but I think that's going to be part of your sort of 1,000-word sort of thing. You need obviously somewhere a description of what actually happens. And it may not be, eventually you'll be looking at process mapping, patient journeys. These are concepts to include into a plan. But at this early bid stage, that may not be necessary, or you may want to introduce an element of that sort of thinking. But, mapping out processes that happen or need to happen they're a good way of identifying your costs and what's needed, and mapping out that patient journey is really a good way of just understanding and planning the project in general. So, Gandhi, do you want to have a go? We don't necessarily need to fill in the boxes live, but just to go through the thought processes. So I know you'd had an idea for a group video pain management project or clinic that you were going to do. So I'm going to let you can articulate rather than write your 100 words. We won't have the 1,000 words.
Okay.
But just fire away, just to illustrate some of the thinking around it, really, rather than needing to watch you fill all the boxes in, obviously.
Yeah. So benefit of using a tool like this, I guess, is obviously you can just copy over the template one that we've got there and name it, possibly put down the funding amount that you're looking at, because we've mentioned about having different levels of funding plans ready. So typically you may get pots of money that are, for example, under £1,000 or £2,000, £2,000 to £5,000, £5,000 to £15,000, and then you get into the bigger pots potentially, and for local projects, you're probably not looking more than maximum, I'd say £100,000, but you never know, on a network level that could be potentially larger and stuff. And then obviously on ICB or CCP-based partnership level, you're obviously talking potentially much bigger pots of funding that you may want to consider. So if we were talking about a chronic pain clinic, a video group clinic, so you put that in the name. You've got the awarding body. Let's say it's from leftover ARS funding, okay, because that's a common
very
pot.
very credible.
Yeah,
there's
so,
often that line.
Bear in mind, we're heading into year end. This is going to be a process I think many people are about to go through in the next few months. So requested. So it's likely to be non-recurrent funding. Let's go for a premise. Idea that they put out a call for a maximum of £100,000, for example, because there's leftover funding for that particular networks and stuff that you can put bids of up to £100,000.
Generally non-recurrent, isn't it?
It is non-recurrent, so
that's a constraint on this particular exercise.
Yeah, potentially. So let's say we're putting a bid in for. We'll figure out the amount in a second. We created that today. Bids. Well, it's me and Andy. Elevator pitch. So let's go for something like to create a video group chronic pain clinic to support patients to manage their chronic pain, both in terms of understanding the challenges they face, as well as medication options, healthcare options, and lifestyle changes, supported through a video group consultation method. Okay,
that sounds good. That sounds like it might be about 100 words, I guess.
Yeah.
And also, what you can do is having gone through the later thought processes of, so you might identify as you're going through the thinking around strategic goals that actually a lot of work hours are lost to chronic pain. That a lot of GP and physio and other people's time is spent handling chronic pain, but maybe not being that effective. So you can maybe allude to a few of these things, in your longer sort of pitch as well, to help kind of establish that need and start to link everything together, I guess. So carry on, Gandhi. So where does this fit in with local, regional, and national strategic aims, would you say?
Okay, so let's have a think about this. So bearing in mind, Andy asked me to come up with this just before we started recording. We'll
do it together.
All right, so NHS England priorities in terms of things that can help general practice. So video group consultations has definitely been seen as a method to try and support general practice in terms of its outcomes and stuff. If we're thinking about the clinical aspects, so reduction in opiate use, we know is a constant challenge in terms of, we know that opiates are a really bad way to manage chronic pain, and actually by supporting patients to understand their medications and their other healthcare options, far more effective. If we're looking at improving quality of life, so things like health core 20+5, we know that chronic pain is a common challenge facing particularly deprived populations and stuff. So for me and you in our local populations, this is something that would have potentially high use case, impact on ability to work, impact on ability to look after families, preventing social care challenges and stuff that come with that and stuff. And obviously the mental health aspect of, all those kind of patients that will be part and parcel of their chronic journey. I guess the other aspects then is also about how can this also be aligned to those patients with complex health needs that are high users of the system? Can this be a method of supporting them with their healthcare journey to understand their healthcare needs more effectively, and therefore actually have less of the acute use in terms of their chronic pain problems, and understanding how to manage acute on chronic flares of pain?
Yeah. I think you did a very good job, Gandhi. I'll just add emphasis to allowing these patients to make more efficient use of healthcare, and
Mm-hmm.
will allude to providing them with continuity through attending, this program that we're providing for them, and improving access by reducing the use of acute appointments in general practice and A&E, inappropriately is perhaps not the right word, but by this group of people whose
Mm-hmm.
needs can be better catered for elsewhere. So I think we're showing that
And I
we
guess just to add in, Andy, this would definitely fit in with the anticipatory care DES that is due to start on the 1st of April. So in terms of future or guidance and stuff that's due to come through, actually this massively aligns potentially to that particular cohort of patients and stuff.
So I guess people are saying that we can actually link this can be linked to specific objectives within specific documents, and start to show that this will help the awarding organisation meet their strategic obligations as well. So yeah,
Okay.
good. So I think we can do a good job justifying this within the strategic fit.
So for this chronic video group clinic, let's put myself and Andy's name down as leads.
Okay,
And
yeah, we'll lead it.
yeah, and I think, in terms of who's delivering it, well, actually, this will be delivered by the practice and PCN staff, but actually in a collaboration with our local chronic pain community clinic, because actually they've got some of this, there's subject matter experts on that particular area. And not to forget that actually, the populations need to be included in this. So actually, there'll be parties in terms of co-production and understanding this kind of process. We may need to approach other groups for advice in terms of how to deliver this, and I'll come to that in a second. But yeah, I think that's the starting point in terms of who's
maybe
going to
have a box. I'm just thinking about the tool. Maybe have a box explicitly for partner organisations, just to invite people to think about the idea of partnering. How does this bid improve outcomes for the population? I think we've already started to allude to that. Really, people should have a better experience of their life through lower experience of chronic pain, allowing them to return to work, be more effective in their caring roles as parents or carers for other people, and have better life enjoyment, reduced use of acute services in general practice and the emergency department. So I think we can speak to those things. How does this tackle health inequalities? So I think often you can make the link, in the initial bid, and then allude to it later, or speak to it more explicitly later, to say that this is a problem that disproportionately manifests in areas of low socioeconomic achievement. So you can link the problem to inequalities. And it might be that some projects people are doing are more targeted. So people might be targeting, homeless groups or particular demographic groups that are shown to have health inequality in terms of their outcomes. So this is where you can kind of link those things explicitly in there. So it's a good section. How does the bid enhance productivity and value for money? Sorry, Gandhi, you're going to come in on one of the points there.
Now, just going to come on this next section. So productivity and value for money. So, in terms of, by providing it as a group consultation method, you potentially can have the opportunity to see multiple patients at the same time, while still also tailoring that to their individual healthcare needs by the model of group consultations. And the benefit of offering through a video group consultation route is the fact that you are then supporting potentially not only those patients, but you have recorded content with consent, as long as you have it, to support patients or increase the accessibility at the very least. So, we're talking about patients that have chronic pain that may impact their mobility. That may mean they can't physically come to a particular location, and actually by engaging through a video route, that means that then they have more accessibility to those kind of services and stuff. So, in terms of saved patient time, saved time in services, more effective use of outpatient services and less DNAs, for example, in terms of, community-based clinics or secondary care-based clinics. There are potential significant gains that you can have through this potential route. And the other benefit, I guess, of a group consultation, as long as one patient turns up, you've still got some use out of it. It may not be as much as you're hoping for, but all you need is one patient to turn up and you've still had some impact. Whereas if it's individual patient clinics, each time that one patient doesn't turn up, that's a complete missed opportunity. So you've potentially still got the gains from there.
Yeah, and Gandhi, I would say here, I think even though both of us are not health economists,
Mhm.
I think if we were putting this bid together, we could make a stab at doing a financial model that is
Yeah.
illustrative to show um, the benefits of operating in a group and reducing the need for acute consultations. Maybe even drawing on some data that we might be able to find from our own systems, or
Mhm.
more generally about the patterns of usage for chronic pain. So we could probably, make a good go of creating a financial model to justify this intervention as well. And
Mhm.
other people can tidy it up later, and we'll say it's illustrative, so people hopefully won't hold us to specific figures.
Okay. Next up, we're then talking about the broader social impacts and socioeconomic impacts. So we talked up partly towards this in terms of opening accessibility to healthcare to particular patients who may have challenges accessing it and stuff. Hopefully, this will then help in terms of their quality of life that can have an impact potentially on the services that those patients use. Maybe even looking at returning to work or more other options along that lines, which would obviously have a socioeconomic benefit and things, and also to the quality of life of the people around that actual individual. We know that patients where the households have challenges with mental health and chronic pain and stuff are more likely to also impact other members within the household and stuff. So actually, there's a byproduct by trying to support those individuals that you have an impact on the others within the household itself.
No, very good. Yep, yep, yep. It's all. I'm sold already.
Fair enough. So what are the risks in management? Well, clearly you have the risk that nobody turns up. I guess that's one issue, but we can mitigate those risks, and we're going to talk about that in terms of the cost delivery and stuff. In terms of the risk of not doing this, well, it's an ongoing challenge that continues to have an impact on service delivery in terms of service use and that kind of stuff. And actually,
Missed opportunity, isn't it?
it's a missed
That's
opportunity, I think.
we're missing out on the savings, and who would want
Mhm.
to risk that? I suppose it's a fairly sort of low risk, isn't it? What we're describing, and I guess
Mhm.
somewhere we can say actually this is a model which has been used elsewhere and has been successful elsewhere and has a track record. So actually using tried and trusted model will help
Mhm.
reduce the risk here as well. Um, so yeah, I mean, other projects might have sort of bigger risks. Obviously, the engagement of staff and practices and things can be a risk. So you might want to, or that it's not recurrent might be a risk
Mhm.
as well. People might really, really like it, but might need to, but there's the winding down risk, isn't there?
Yeah.
That might occur if we start to employ people. But we can think of some mitigations and how to reduce those risks within how we design the system. So anticipated
Well,
time to implement. Oh,
we're talking
go on,
about,
Gandhi.
potentially using ARS funding. So actually, one of those opportunities is that if this is successful in the kind of pilot year, that actually there is lines of the ARS funding to support the ongoing use of it and stuff. So actually, that may help.
Yeah.
And then we talked about system changes that could benefit or hinder this. So I mentioned again, ARS funding is there. So actually, could this be rolled into the network's existing ARS funding to continue the service? Hindrance, actually, we don't know the future of networks post 2024, apart from the fact the ARS funding is due to continue. So actually, is that a hindrance potentially, possibly, etc. and stuff. Then let's look at the costings itself. So because this is obviously the part that I think then is a bit more structured, but also challenging to look at. So, staff costs, if we're talking about using underspends of ARS funding, this is the main reason for the funding existing. So, it's the staff. Is it going to cost a lot of money? Well, not really, I don't think. I think what you would really want to have is a digital care coordinator, somebody to support the patient engagement with the online platforms and the video consultation routes. And a care coordinator role could be really exemplary at helping with that aspects of coordinating the patients to engage with the services, troubleshooting the challenges they may have in terms of, onboarding with a video platform or attending and that kind of stuff. Potentially having something like a health wellbeing coach involved from the staffing perspective.
You've highlighted a technology risk,
Mhm.
and worsening health inequalities, and there's a whole just going back to the risk section there. But
Yeah.
that's really good things that are just coming out.
But then at the same time, mitigation is having the specific individual whose
Yeah.
role it is to help engage those patients with those platforms themselves. And obviously, they would hopefully then have the developed skills and understanding of how to support those patients and stuff. Because it is possible. It just takes time, and that's what we're buying here, isn't it? We're buying time.
I'm just thinking here. I'm just thinking here, Gandhi. I guess in terms of the scale of the staffing that we're asking for, I guess earlier we can have made an assessment of the scale of the problem. How many
Mhm.
patients with chronic pain do we have in our theoretical primary care network, and what proportion do we think might be appropriate for this sort of approach, and that might inform
Mhm.
the number of hours that we want to run of this per week. And it might be that we
Mhm.
think in that way and say we want to run two 90-minute sessions per week, or alternate weeks, average one a
Mhm.
week. We just have to think about the scale in terms of what
Yeah.
that'll help inform these costs, won't it? So
Mhm.
are we going to have a care coordinator working half of their time on it, and a clinician
Mhm.
working half of their time on it? Because there's some development work as well, isn't there, to develop this, because it doesn't just come out of the box working.
No.
So actually there's project management time, but we've got to develop the offer as well, so we have
Yeah.
to account for that too. So I don't know, maybe that's the amount, include the on costs in there. Estates, we need a room, I guess, in
Mhm.
a suitable environment. It might not need to be a GP surgery. It might even be people's homes, because this is
Yeah.
delivered remotely, isn't it? And that's how we save costs, and that's some of the attraction of this project. So we can acknowledge that in the estates section,
Mhm.
I guess.
And similarly with equipment as well. So you are going to need some video-based equipment. You need the platforms to run it off, whether that's Teams or other kind of platforms and stuff. Are you going to need some onboarding support in terms of showing patients how to do that? So time, like you said, the project management time, do you have to create, for example, a guide for patients of how to onboard themselves? Or is it even more structured in terms of having somebody specifically go around to the particular patients and show them how to use the system in the first instance before the actual session, so then they know how to do it and things? So it's thinking about those opportunities and things that come into play. Project management, we've talked about, you need some costings of actually the fact this is going to cost a little bit of money to get started. Where's that funding coming from? Is that from the Rs fund, the Rs underspend pot, or is it actually you may need to consider adding some additional funding into this to support it, from existing pots that you already have? And then obviously there may be ancillary costs that come with this in terms of outcomes, reports, that kind of stuff as well that need to happen.
Oh, and Gandhi, let's add some training costs in, to the staffing, because I
Yeah.
think we might need to train people both on the technology and both on group consultation approaches to
Mhm.
chronic pain. So we might want to find a course for them to do, and include that in the costings as well. Just an example of
Mhm.
something else to consider, that training requirement. And maybe there's an engagement need with practices, or those people that we would want to refer people into the service, to make
Mhm.
sure that we have enough referrals in. So maybe we want to do some sessions with the surgeries. I'm not quite sure what that would look like at this stage in planning, but we can put a cost line in for it, I guess.
Mhm. And then hopefully that will give you an amount that you can then put into the bid right here at the top.
So,
Yeah.
so Gandhi,
Job done.
I have quite a lot of confidence in this bid that you've put together. It
Mhm.
feels really, really well structured and well thought out. But I think that's because you've applied some logic and you've gone through a template. I can really see how this would be useful for an individual, or a group of individuals, to kind of just quickly flesh out an idea. And also by the end of it, you might have a sense of whether it's actually got legs or not,
Mhm.
as a project, and you might actually find a lot of flaws in what you're proposing, or that it's just going to be ridiculously expensive in terms of the impact. So I think that's a really good tool that we've walked through there, and hopefully it will be useful for people as they keep their bids warm in the background, ready
Mhm.
for pots to become available at short notice, and maybe even some ARS underspend in the near future.
And if people do want to access that particular tool, the link to it is down below in the description of the show notes of this particular episode and stuff. So you can go and access it easily, effectively. And yeah, hopefully you'll find that useful. If you've got parts that you think we could adapt, let us know. Happy to add in, we may be adding some extra columns in there already, just as we've kind of gone through that again, in terms of actually parts that may be more useful to add in and stuff. And, hopefully that will be a tool that you find really effective and useful, particularly as we come into bidding season, because it is, isn't it? Coming up to March, it's the season for
It is.
putting your bids in.
People need to get the money off their books and and spent, I guess, as often happens both in the
Mhm.
NHS and everywhere. Cool. So hopefully people have enjoyed that episode and found it useful.
Mhm.
And we'll see people again in the future with hopefully lots of useful content.
Let us know
Going
if you
forward.
have found it useful. Comments down below, very much appreciated. If you found this particular content effective, do subscribe and like the video and share it actually with other people that you think may need to know how to do this more effectively, or even better yet, share it with your colleagues before you actually have the meeting where you're going to talk about doing this within your practice, within your network or wider area. And as always, we'll join you to tech enhance our primary care and learning in the next episode. See you later.